Happy Friday, everybody.
Happy Friday. Also, we are live on YouTube. I'll put up the screen in just a sec.
Thank you.
Test, test.
We hear you and
Yep.
see you.
All good.
Message folks in the chat. Hey, Carolyn, we can go ahead and start letting folks in, open up the room. Hey, everybody. Letting everyone in the room. Welcome. We'll get started in a few minutes. Just gonna give some folks time to log in. Hey, we're just giving folks a few more minutes to log in. We'll get started at 1:05. Yes, TGIF, everybody. We made it to another Friday and almost the end of another month. If folks want to share in the chat as we wait, allow folks a little bit more time. How you feeling? We made it. It's a new season. Happy fall. Is it Leo season yet?
Yeah, well, I have.
Okay, everybody. Looks like we're about time. As folks are logging in. Welcome. Welcome to this week's City Worker Briefing. My name is Dr. Watkins. We're here supported with folks from the NYC, DOHMH. Takesha, you may have to log out and log back in because I don't know if other folks are experiencing sound issues. Welcome to this week's City Worker Briefing hosted by the New York City Department of Health and Mental Hygiene. This is a collaboration between city workers and the health department and folks at Workwell NYC to bring up-to-date information from the health department to city workers, for city workers to answer questions. Folks on the call, we're all health department, public health folks. We can't really speak to a lot of some of the policy and legal changes. We definitely hope to bring the most up-to-date information in developments around the ongoing public health crises that we are addressing as a city, both COVID-19 and MPXV. Folks may notice the new acronym MPXV, where the city was trying to promote a new kind of way to talk about this thing and minimize stigma. But we will go ahead and get started. Next slide, please. We're using MPXV internally and externally, but I think some of the data, some of the materials and things that have been produced may not reflect it because they were produced before this name change. So what folks can see on the screen right now, we can see we begin with talking about COVID-19, this ongoing health crisis. What folks can see on the screen is the cases and community transmission across the 5 boroughs. And this is a representation of all of the trends across the boroughs. And as folks can see, over the last couple weeks, we've had a slight uptick or a slight increase in cases across the 5 boroughs. So keeping an eye on that, the cases is not a steep jump, but something just to keep an eye on, especially as if we go by historical reference. Fall and winter has been tough in the era of COVID-19. So we're keeping an eye on this, and we'll definitely be talking about what the messaging, what the public health guidance and messaging is for the coming weeks and months as it gets colder across New York City. Next slide, please. What we do, one big announcement that we wanted to share is the availability of the bivalent boosters against COVID-19. We say bivalent, bi meaning 2, valent, I guess the easiest way to there's 2 sites, 2 points, 2 targets. And so there's a target for the original vaccines, but then there's also for the original virus, but then there's also for these Omicron variants, which are the dominant variants that are spreading around the city. These new vaccines were recently approved. There 2 manufacturers have gotten their boosters approved: Pfizer and Moderna. These are the most prominent vaccines against COVID-19 in the United States. There's a range. There's a couple other vaccines that are available, but the Pfizer and Moderna bivalent boosters are the only updated boosters that are authorized in the United States to target these Omicron variants. Folks are getting vaccinated across the city, and for eligibility, who can get it? Anyone who's 18 and older can get the Moderna bivalent vaccine booster, as long as it's been 2 months after they've completed their primary vaccine series or their last booster. For folks, eligibility for Pfizer is a bit younger. Folks who are 12 years and older can get the bivalent Pfizer booster, but the time constraint is the same. We would want the eligibilities for at least 2 months after you've been fully vaccinated, or at least 2 months after you got your last booster dose. Folks can get boosters of any brand, regardless of the primary series. For folks who are looking for the vaccines, you can check the vaccine finder to get the bivalent booster. I see a question in chat. We can maybe take: will the city allow CH to be a site? Do not know about where the city will put up locations for the vaccines. We hope that it will be brought near and wide. How long after infection can you get the bivalent? So that is a little bit less concrete. We don't really know exactly how long the protection for it basically all depends on what you were infected with. For most folks who were infected within the last few months with the Omicron variants, if you were infected within the last maybe 2 to 3 months, most likely you were infected with either the BA.5 or the BA.4 variant, which this vaccine covers. And so what we're asked, so the recommendation, folks can actually wait up to 3 months after recovering from a COVID-19 infection to get the booster. We do know that there is some protection from recovery, but we've seen that depending on the strain, that protection may be a little bit less. Yes, so 90 days after an infection, at least 2 months after your last booster or after you got your second dose. Well tolerated. I haven't got mine yet, but definitely going to go really soon, and I will report back on how that goes. And if folks have gotten boosted in the chat, feel free to share if folks have any questions about your experience. Next slide, please. On this slide, nothing's really changed in terms of who can get vaccinated now, but the big push, or what we're trying to how we're phrasing it for communities is, thinking about fall and winter season, how we can kind of keep ourselves safe. COVID is top of mind for many. May not be as top as it had been in last winter or fall, but just knowing that there are these seasonal things that we have to do to keep ourselves safe. So thinking about winter safety against infectious diseases. There's influenza, there's COVID-19. For some folks should be considering protection against MPXV, monkeypox, which we'll talk about later. And also just getting up to date on all the other things. We do know that across the city, vaccination rates, routine vaccination rates have come down across pediatric populations, which has definitely impacted what we're seeing upstate and in the water supply in terms of evidence of polio circulating in the community. So really thinking about what we can do to keep ourselves safe in terms of, vaccine interventions, also general health maintenance, going to providers, getting our checkups, getting our screenings, making sure that our, any underlying medical conditions are taken care of. And then also the last bit is knowing what tools we have. We have a lot of tools that are non-medicine, non-vaccine that can keep us safe. Folks can, wearing masks, considering wearing masks when it gets cooler, and if we see rates of infection go up, physical distancing, things that we can do for risk reduction, harm reduction, avoiding large crowded indoor spaces, testing, really thinking about how we want to test, when we test. All of these are part of how we can keep ourselves safe, part of this bigger toolkit, and hopefully we can have these conversations with ourselves and with the people in our communities, families, friends, neighbors, co-workers, just how we want to keep ourselves safe and have some accountability and look out for folks and encourage folks to start thinking about these things sooner than later, because we would hope that a lot of these things are preventable or avoidable if we take a few extra steps. So just wanted to share that, and we can go to the next slide. Just reviewing some of the vaccine data for children and adults, we have not seen a lot of change over the last few months. As folks are aware, the pressure to, I guess the urgency around the COVID-19 pandemic has come down a little bit. Folks have probably heard on the news there was a kind of a glib statement saying that COVID-19 was over. It in fact is not. COVID-19 is real. We definitely are seeing folks being infected in New York City, and so we've come a long way. But as we look at this new boosters and these new circulating variants, we definitely want to make sure that we stay vigilant and make sure that we vaccinate our most vulnerable, specifically folks 65 and older. We want to make sure that those folks who've borne the brunt of morbidity or like COVID deaths, but we also really want to protect our school-aged children, our younger folks, making sure, as folks are back in classrooms, even though we have seen that kids are not typically getting as severely sick as some of our oldest folks, we do know that children do get sick enough, and some are ending up hospitalized and developing complications. So anything that we can do to keep to vaccinate our children and the most vulnerable amongst us. And then for those of us who may have been infected before, or who may be on the younger side, who may not be as concerned for COVID death, what we can do to vaccinate ourselves, not just to protect ourselves and prevent us from being hospitalized, but what we can do to help those around us in our circles who we engage with. So yeah, it's all part of this bigger bigger approach to kind of keep for community health. We will keep reporting on our data, but we haven't seen many big changes in the last since we last met. Next slide. Getting tested. Talking about testing. Encouraging folks to get home testing. That's definitely that home test will definitely be an important tool for the next few months for us. Getting tested specifically, before big winter traveling and before other events as we kind of move into the winter months. There's some guidance about like when to test. If you have symptoms, getting tested. Immediately after you develop symptoms is important. Getting tested after contact with an exposure, it will be important. Before and after travel is important. All of these, thinking about when to get tested is really important. Next slide. So we have a lot of, we always want to talk about treatments for COVID-19. I think it's really important that we keep it in mind, and we always talk about it, so that if you guys hear of someone, if they get infected and they're having symptoms, just let folks know, hey, there's treatments out there. Because what we know that these things have been out there, they are effective. They're not a substitution for vaccination, but they definitely are helpful to help reduce some of the worst symptoms. And I haven't seen the recent estimates, but since the treatments have been available, we definitely have been able to prevent thousands of hospitalizations and deaths due to because of these treatments. So these are available, and folks can get them across the city. But so if you test positive and you are concerned for developing severe symptoms, there's actions that can be taken within the first 5 to 7 days. Next slide. Wanted to share this. This is more so just like an awareness for folks who work with or who are members of community or faith-based organizations, health and hospitals, the test and trace. They're looking for community partners to be home distribution programs. So if folks know of a New York City nonprofit or an organization or house of worship that's looking to become a distribution center, we can definitely share information on how they can get their church group or their other community group or org connected. But some of the things that they're looking for to enroll folks in this program are organizations that are committed to civic engagement, which have the capacity to reach a large number of New Yorkers. I think probably an asterisk for what large means, because that's very relative. And then the ability to store the kits safely and distribute them for free to the public. We want to make sure that they are free. So if folks are interested, we can definitely share some of the details so that folks can share with organize wherever folks are engaged, want to share this important opportunity. Next slide. For the next part, before we transition to MPXV, I think something that we really do want to focus, we don't want to just focus on the difficulties, focus on gloom and doom, and the fear and urgency. So we wanted to just share an important milestone that the New York City Department of Health celebrated last year. So last year we celebrated the 1-year anniversary of the New York City Public Health Corps. This was a collaboration between the health department and other city agencies and health and hospitals with the core mission to ensure that COVID-19 vaccine equity is advanced through community-centered approaches. So partnering with folks in the community, partnering with community-based orgs, faith-based orgs, partnering with the community action centers, the health action centers that are located across in three of the 5 boroughs, and really making sure that we can focus in some of the neighborhoods that have been hardest hit. So as folks may be familiar or not, we'll just as a refresher, towards the earlier part of the pandemic, we saw a lot of disproportionate impact on certain communities. So taking into account the some of the data on COVID-19 and other factors such as race and ethnicity, income status, and other things, the city identified 33 neighborhoods that were the hardest hit and created this task force under the prior mayoral administration called and identified these TRE, the Task Force for Racial Inclusion and Equity, to focus efforts on places and get resources in places that need the most that need the most investment and resource allocation. So we've celebrated this this 1-year milestone, and we can go to the next slide. And I think it's a testament that a lot of these things that we see, you know, these inequities and these disparities that we see across race and across class and in certain parts of the city, that these things can be reversed. And so some of the main accomplishments, things that we've accomplished from September 2021 to September 2022, over 23,000 in-person vaccine events happened across the city as part of this program, where over 1 million folks were reached, 1 million folks participated. That's around 1/8 of the entire city has been reached, and folks have shown up. The partnerships that we've made, we over 90 community-based organizations, 20 faith-based organizations, 13 federally qualified health centers. These are centers that are located in communities and typically serve large proportions of folks who are underserved by more for-profit entities. And basically what we've done in this partnership, at the beginning of the program, the neighborhoods that we identified, these tree neighborhoods, they had lower rates of vaccination compared to other communities. At the beginning of the program, when we first kind of started this engagement, the vaccination rates were around 64% on average in the tree neighborhoods. In that year, we were able to get those rates up over around 22%. Just through all of the engagement, multiple touch points, but also really partnering with trusted messengers and really removing ourselves, not decentering ourselves, and really making space and helping out community folks who trusted messengers, folks who can speak in language, and folks who can speak in terms and ways that will resonate with community. So we really did want to share that. This big milestone, that these things can be changed. We can move to, we can erase some of these inequities that we see developing, which I think is a good point as we talk about MPXV as we transition on the next slide. So now we'll talk about MPXV. I think we're doing pretty good on time. So what we'll do is we'll just take all the questions towards the end. We can kind of brush through some of these repetitive slides, but looking at the U.S., luckily in New York City, what we are seeing is that the cases are definitely slowing down. We'll look at that on the next slide. New York City is making up less of a percentage of the overall cases in the United States, which just shows some places are in a different position than we are. Hopefully, those places can get the outbreaks under control as well. But yes, New York City, we have over 3,400 cases identified as of yesterday of MPXV. Next slide. This is a representation of the cases, and as folks we review every other week, the trends are going in the right direction. We're seeing cases across the five boroughs coming down. So we keep a track of this. This is where we want to see. This is what it looks like to get a curve flattened. This is the results of a lot of engagement, a lot of folks getting vaccinated, but a lot of communities stepping up, modifying behavior, reducing risk, and getting information out, raising an awareness. A lot of folks know about this, and a lot of folks are really able to step into action and contain this thing. Next slide. Just looking at cases by borough, pardon for the blurriness on the screen, but as we can see, the majority of the cases were in the borough of Manhattan, followed by Brooklyn, the Bronx, and then Queens. But there were also cases in Staten Island as well. We can go to the next slide. Looking by race and ethnicity, communities that are historically marginalized have had greater impact. So folks who identify as Hispanic, Latinx, Latine, Latino had the highest case counts per race or ethnic group, with over 1,100 cases, followed by folks who identify as Black or African American, then followed by folks who identify as white. For looking for sexual orientation, again, noting when we report this data out, LGB is understanding that folks, trans identity is not an orientation, but a gender identity. So yes, this outbreak has disproportionately affected folks in the LGBTQ and trans communities, and folks in the networks, social and sexual networks. So yeah, one community has borne the brunt, but as folks can see at the bottom, that folks identifying as straight have also been affected by this. And so just acknowledging that this is not a gay or queer or trans disease. This is a thing that can affect all human beings. Unfortunately, this just found its way into a very particular set of social networks. The number at the bottom in terms of unknown just reflects that we do have limits in the data. We have limits in data collection. Some folks who are testing positive are not reporting. We're not reporting their sexual orientation, or it's not being collected at the site at testing sites. We know that working in the field of sexual health and HIV prevention, folks do not take some of the best sexual histories, just because of there is a stigma. Even from the medical side, folks don't ask some of these questions or don't feel comfortable. So that kind of reflects why we see a large number of unknown or unreported for sexual orientation. Next slide. So who is at risk? As I already said, anyone is at risk. As we know, certain networks have been disproportionately affected, and people in these groups who have multiple contacts or anonymous contacts are at higher risk. But luckily, as we can see, that the results of really targeting or not targeting, but really focusing our efforts to engage those most at risk, that we can actually really start to slow cases. Getting the resources where they need to be, being intentional and being inclusive, knowing the diversity within the group. These are all ways that we can contain infections, contain outbreaks. And so yes, anyone can get it, but we focus a lot of attention on those who are the most immediately at risk of exposure. But definitely the conversation is how we can make sure that we can keep this outbreak suppressed and make sure that it doesn't rev up again when things start getting cooler or colder. Next slide, please. So how does it spread? Nothing's really changed there in terms of how it's spread. This is primarily spread through direct contact. This is what we call a communicable disease, spread from person to person, also spread from person to animal. That's kind of how it got in the human population originally. But direct contact, we know that contact with sores when someone is actively infected is the most common mode of transmission. Also, folks can be infected through contaminated clothing or bedding or other personal items, but we definitely think it's from repeated exposure. So this is folks, sleeping in the same bed or wearing the same clothes, or folks who are, live with someone who's infected, who are contracting MPXV through these inanimate objects. And again, as we always say, there is the possibility for spread through respiratory droplets. That's why we encourage folks who are infected or think they're infected to wear masks. We've talked about some of the other things at the bottom, and we can go to the next slide. Symptoms, nothing has really changed in terms of symptomology. There's a typical kind of skin rash that can present in typical and non-typical, or the usual spots and the non-usual spots, which we've talked about in this space, but also having folks understand when your immune system activates, folks get a pretty typical kind of what we call flu-like or COVID-like or viral-like syndrome. So people can get fever, swollen lymph nodes, headache, muscle aches, back aches, swollen lymph nodes. All of these things can happen when we're infected with things. That's how we get it when we're infected or when our immune system is activated. And there's only a couple of things that activate our immune systems: infection or vaccines. And so that's kind of why we also kind of see some of the immune system, some of these similar symptoms when folks get vaccinated, because the immune system, when you rev it up, this is kind of what you feel and go through. Next slide. So protecting our community, for this one, just really wanted to, just highlighting that we have a lot of materials that are constantly being updated and uploaded on the health department website. Encourage folks, they want to check, there's a lot of good source materials on the website. Definitely encourage folks to read through things, print things out, share things around, post them on your fridge, keep them on your phone. All of these references are really good, so that just so you know where you can point people to, or you can direct yourself to, if you have a question, or you really need to know how to manage certain questions, frequently asked questions. We can stop there. Next slide. Some updates. So last week was a pretty busy week. So last week we opened up second dose appointments, or eligibility for folks who have been vaccinated, who've received their first vaccine for MPXV. Folks can get it now if it's been 28 days or 4 weeks since their first since they got their first vaccine. This was in response to community demand. Definitely wanted to make sure that we don't want to frustrate folks. We want to get folks their vaccines as soon as possible, and a lot of that was driven because we had a big influx of vaccines into the city. So also last week, 50,000 appointments were made available in New York City, because we got a disbursement or delivery from the federal government. So those are up and live. Folks are able to get them. Folks are getting vaccinated. Another big update is that the city also expanded eligibility of the vaccines to people who are 18 and under, who meet the other eligibility criteria. It's important to note, for people 18 and for people younger than 18, there are New York State public health laws that require parental consent. So for minors, they have to have parental, guardian, or legal custodian consent, unless if they're a minor with a group that can consent on their own. So these are, emancipated minors, married minors, minors who are parents or pregnant, or minors in the military. Oh yes, love to hear people getting their shots. So yes, so the vaccines have been opened up for folks. It's all about expanding. It's all about access. That's my primary goal, to get folks, to make it easier for folks to get these vaccines. Folks probably may see or hear folks of our community partners out handing out information, talking to folks. Folks may have seen folks out in the community, at events, handing out information, and even bringing vaccine resources, vans and trucks, to discreetly be around certain events to get folks to bring the vaccine to where folks are. Again, in response to our community partners and working with folks to make sure we can bring the goods where they need to go. For folks who want updates, encourage folks to text 692-692, text Monkeypox to 692-692 for alerts, and keep an eye out on our website for updates. Next slide. The vaccine eligibility, a couple weeks ago, it was expanded to folks who are sex workers or engage in survival sex, regardless of sexual orientation or gender identity. Again, it's all about expansion and access, making sure that folks can get it. Hopefully we can see continued expansion in the coming weeks. Next slide. So looking at the overall cases, of the vaccine, we vaccinated over 100,000 folks in New York City. A major feat that was only accomplished through the group efforts of a lot of folks engaging, a lot of communities stepping in, and then a lot of folks going out and getting and putting their arms out there to get that shot. So it's really encouraging to see that we've been able to get these vaccines out there, and then to see that, and then to see the results. It's very rarely in life do you see you see an intervention, and to see within a few weeks to see how things can shift. You can shift the tide and really flatten the curve, and get the largest city in the United States can get an outbreak like that under control. So kudos to all the folks who've been doing the engaging, talking about this thing, and just sharing information and getting resources out there. Next slide. This is some of just the vaccine equity distribution data. This hasn't changed much. We just, again, just a lot of the work right now is driving to make sure that we can make sure that distribution is equitable, looking at race and ethnicity, focusing on our Black and African American New Yorkers, our neighbors, friends, family members, making sure that we can get those folks vaccinated, meeting them where they are and addressing their needs. Looking at the borough, definitely by borough, engaging folks in Staten Island, Queens, and the Bronx as places that still have need additional resource and need to get vaccines up. Definitely just paying attention to what's going on the ground in these places and with their particular situations and the social dynamics. Just making sure that we take all of that into account and really trying to avoid be more tailored versus one size fits all. Next slide. Same thing for age, working with partners. We have some partners in sister city agencies. Hopefully some of our folks in DIFTA may be hearing something about some of our engagements soon. But yeah, just make sure we can get folks, older New Yorkers vaccinated, and then also folks who are 24 and younger. We've seen that the number of vaccines has been it's been a little bit lower than the group that's been the most affected, 25 to 44. Those folks do have been vaccinated. A lot of vaccines in those age demographics, but we'd also know that across the spectrum of age, we have to make sure that we equitably distribute. Next slide. So what to do if we have symptoms? Again, we won't belabor some of this since we kind of review this. Basically, there's a lot of resources out there, but encouraging folks get tested if you think that you have it. There's a lot of information and resources to just kind of help guide you to consider MPXV. You don't have to be an expert or be a doctor to make this diagnosis or be concerned. But the first thing is an awareness and to know what are the things I should be looking for. And if this is something, with the social history, with my potential exposures and what my symptoms look like, is this something I should be concerned about? If so, reach out to a healthcare provider and take the steps to make sure that if this is something contagious, that it doesn't go to someone else. Next slide. For care and treatment, the care and treatment, we post care and treatment recommendations on the website. It's a bit more extensive than what we have here. Do want to share there's an upcoming webinar next Thursday from 12 to 1 that the health department is hosting in partnership with New York State and the Skin of Color Society. This is an international group of dermatologists who focus on care for folks with melanated skin or folks with darker skin. So we're hosting this webinar next Thursday. Invite folks to come. It's going to be primarily provider focused, but we definitely let them know that people, non-providers and other folks will be tuning in too. So hopefully folks can get questions answered, because there are some other concerns to think about in PXV, particularly from the infection itself. For folks who've been tuning into this space a lot, when we talk about when we talk about treatments, we talk about vaccines, we talk about interventions, a lot of times there's a hyper focus on possible side effects from, vaccines or treatments. But it's important to not lose sight of what can happen, what we are trying to prevent, what these treatments and what these vaccines were created to help prevent, and that's complications from the infection itself. So hopefully next week when we have this conversation with the Skin of Color Society, we can open up the conversation and talk about some of the things to look out for if folks are infected with monkeypox, how they can prevent scarring. Scarring is a big concern in terms of darkening of the skin, lightening of the skin, or just scar formation that can last for a long time. So more on that soon. We'll definitely make sure to share out the flyer when it's made available. And yeah, hosted by New York State, New York City, and the Skin of Color Society. Next slide. So what can we do as we talk about it? All of you all showing up here, as we've been having these meetings, is one thing that you can do to arm yourself or to learn information, know where to point people, be up to date, and know what's going on. And I think a big part of it is, we know that stigma is real. We know that all of these that it is concerning to see, hear about a new outbreak. But I think what we do, in public health, we do owe folks. It's our responsibility to talk about the issues. And I think there's one thing to raise an awareness of issues, and there's another thing to cause panic. And that's what we don't want to do. So we talk about the issues. We want to, tell it like it is. And at the same time, what we don't want is for stigma to get out there. So we have to answer the questions. We want to make sure that other folks aren't answering or filling in the gaps. And so whatever we can do to help support, get the information out, support those of us, if either ourselves or our friends or family, community members who may be at higher risk or who may have been infected, to make sure that we can, help support them, help protect them, get the message out. And then also just educating ourselves. This is important to know the issues, to be engaged, to kind of know what's going on in the city so we can keep ourselves safe. And then finally, the last bit, really just making sure that we support folks, not just for their physical health, but their mental health. As it's getting cold, walking out, I was feeling a little down in the dumps this morning with the really cold weather. So just, as a reminder, seasons do affect folks' mood. So just being mindful of that. And also, just stay connected. If someone is isolating, someone has been infected, letting them know that they're not alone, then there's ways that we can all support them, either financially, dropping off food, supplies. All of these are things that we can do to kind of help someone out and help them through a really tough time. We can stop there. And I think Dr. Wong can come on the screen.
Yeah, hi everyone. Thanks for joining us today. So I'll go ahead and get to the pre-submitted questions. We actually only have like 4 minutes for questions right now, but we'll try to stay on for a little bit after. But I cannot guarantee that we're going to get to any questions in the chat, but we'll try our best. And we definitely can collect the questions from the chat and sort of roll them into the meeting 2 weeks from now, I think would be one way to go. But I do want to get to the pre-submitted because people did spend some time thinking about that. So we'll start with COVID. So the COVID-19 questions. There was a question about getting on one informational sheet on how to prevent exposure within the household. So I'm just going to go ahead and post 2 links for that. But there's a lot of information on our website about sort of taking care of yourself, getting treatment, getting help, as well as sort of how to isolate and how to, manage things in the home. But, largely trying, I always think about like increasing the ventilation in your home, wearing masks in the home, and sort of cleaning high touch areas like doorknobs and faucets and things like that. Those are the main things. And trying to isolate as much as you can. I know it's really challenging in a New York City apartment, but trying to isolate as much as you can and really thinking about like who, if you have someone who's immunocompromised in your household, trying to work hard, trying to do as much as you can to keep that person from getting it. In terms of why are people not required to wear masks on the subway and elevators and other crowded places? So the mask mandate in New York State actually went away. We still, as the city, we still really recommend wearing masks, but, political appetite for making it mandated is really challenging, and it's really hard to be able to really tell people basically what to do, quite honestly. And so it's ended up being a personal decision for everyone. I don't know about what newsletter pick about a Black male not wearing a mask. I honestly don't know what newsletter that is referring to. And, whoever's publishing it, I'm not really sure why they chose that picture, quite honestly, so I can't really comment on that. But there's no new information that Black males are immune or spreading illness, just to finish out that question. But really, it's everybody. So everybody needs to do their part. Where can I take a test for COVID? There still are a few city sites that are still open for PCR, and then, home test kits. If you want to be able to try to get a home test kit, I believe a lot of the libraries are still distributing home test kits, as well as, check in with your city agency. I know the Department of Health still has options, just depending on what you have in stock. So, and how many are left. I will say federal funding for testing has not been continued. And so basically we're using up what we've had until it runs out. The other thing is, I know if your child goes to public school, I think you can also request one from public schools as well. Oh, even though a person's taken their booster shot and is vaccinated doesn't mean they can't get COVID over and over. Yeah, so the vaccine protects you largely from hospitalization. And maybe next time we can put in the slide, or if we have time at the end, we can kind of show the data. But even being vaccinated does protect you. It's not 100%, like most of us have gotten COVID despite being vaccinated. But if you remember that first really terrible wave when we shut down, New York City does not look like that. I know we don't want to remember that time period, but that's what it would look like if we didn't have vaccines on board. So the fact that we're like basically completely open at this point, and we don't see the hospitals getting overrun, we don't see the trucks full of dead bodies, I think is really like a very tangible way to show that vaccines have really worked. And, the fact that New York City has high vaccine rates, and that's really protected us as a city from really the devastation from that very, very, very first wave. So it's not 100%. Yes, you will still get COVID, very likely, but it still does protect people from getting COVID. I think I think someone who is unvaccinated is actually still 3 times more likely to get COVID based on our data than somebody who is vaccinated. And then the person who's unvaccinated is around 6 times more likely to be in the hospital, and also more likely to die of COVID than someone who is vaccinated. So we do have data to show that. We'll try to display that next time. Okay. Current recommendation for interval between COVID-19 disease and getting the bivalent or enhanced COVID-19 vaccine. So you can wait up to 90 days if you want to. You don't have to, but you get decent protection up to 90 days after having COVID. This is an important question. What resources are available for coping with anxiety concerning COVID? I think the resources that we usually recommend are NYC Well. I don't know if someone is able to put that in the chat for me or not. But NYC Well is a great resource. I'm sorry, I don't have the number, and I don't remember if it was in the slide deck or not, but if someone could pop that in the chat, that'd be great. The other one is, I think, for city employees, there's also the Employee Assistance Program, and they also are really, really helpful in terms of like being able to provide support and care, and even connections to sort of mental health support. So EAP, Employee Assistance Program, that's available to city workers, is also an option. Thanks for posting that in the chat. Appreciate it. Okay, I think that's most of the COVID questions that were pre. Oh, the COVID. Okay, so COVID bivalent booster vaccine is available. Will this be mandated for city workers to receive? I don't think it's going to be mandated. I don't think there's really any political appetite to do that at this point. It may be mandated in certain populations. For example, people that work in hospitals, people that work in clinics, nursing homes, places like that. Maybe others that I'm not totally aware of. But really, kind of healthcare settings is probably the place where it's going to be have the strongest mandates because they care for the most vulnerable populations that are most likely to die from COVID, particularly, people over the age of 65. Okay, so I think let's get to some there's not as many monkeypox cases. And then if we have time, we'll try to bounce back to some of the questions in the chat. For monkeypox, how long does it take let me just go. Dr. Watkins, anything you want to comment about any of the COVID questions before I jump on to monkeypox?
I think the only thing about this is just looking at the bigger picture. Vaccines, treatments, these are all interventions to help minimize risk or minimize harm. Nothing is perfect, but what we have seen, over the course of this pandemic, from that first wave, 0 people were vaxxed, and a lot of vulnerable people we lost. And since the very first wave, we've seen the majority of the folks who have been hospitalized, severely ill, and passed away have been unvaxxed. And I think that's been one of the constants. So it's whatever we can do to help minimize risk, minimize harm, and vaccines are part of it, but there's all these other things too. And any story of someone who was possibly unvaxxed and walked out unfazed does not invalidate the fact what we're seeing in terms of how effective and how helpful these things have been at really getting us to a place where 2 years ago I think we were dreaming about not having to show our ID or whatever to walk into the store, so not having to stand 6 feet in line and all of that. So it's definitely been part of a bigger the bigger pictures, helping to reduce harm and reduce risk. I'll stop there.
Yeah, and I'll take one question from the chat just because it's been asked a couple times by the same person, but just the question about sort of Ebola versus COVID. Ebola and COVID are two extremely different viruses. And so I think it's important to know that for every disease, and monkeypox is also a virus, so every disease is really different from each other. Ebola is not really spread through the air the way COVID is. Ebola is really spread through very direct contact with body fluids. And so it's much harder to spread Ebola than something like COVID, where someone could just like cough it out into the air and it sort of floats around. And so it's a very different way of transmission. And each virus, without getting into like all the scientific details, each virus transmits really differently, and the characteristics of each virus or bacteria or whatever it is that's spreading around very different from each other. And so that's why you cannot compare. COVID is just so much more contagious than Ebola, and the way it's transmitted is also much more contagious than something like Ebola. So just very different. They can't really be compared, but I just wanted to like be able to address that. Like, this is why every public health response looks very different from each other. And they're not exactly, I know we carry a lot of like personal experience. Like, for example, I know a lot of people are carrying the COVID experience into monkeypox, and that is actually not, you can't do that basically. So I recognize a lot of people are carrying a lot of trauma from previous responses into the next response. And so I'm just recognizing that that's there. Okay, sorry. Maybe we can do like a
couple more, but I think some rapid fire. We're recommending vaccines for boosters for pregnant folks as well. What else?
Yeah, COVID is really bad in pregnant women. It's bad for the baby. It basically causes clots in the placenta, and has a high risk of causing miscarriage, the baby being born early. And just like decreasing blood flow to the baby. And so that's why we definitely recommend for pregnant women, really making sure you're up to date on the COVID vaccines. Okay, I guess, can we answer a few monkeypox questions and then we'll jump back? So in terms of how long does it take when touching or handshaking a person exposed? Is it seconds, minutes? So, monkeypox is really not spread through like handshaking. We really haven't heard any cases that are like that. So yeah, it's really hard to spread. I guess theoretically you could, if you have like a really large like cut on your hand and you happen to touch like somebody who had like a monkeypox bump on their hand, and I guess that could happen. We really haven't heard cases like that. The cases where we've heard are very intimate, like direct rubbing of skin, where it's very intimate and sort of very prolonged contact. So I don't think this is like something that I would worry a ton about, quite honestly. Is the monkeypox vaccine free? Yes, it is. Are there plans to expand monkeypox vaccine eligibility? Yeah, so we don't have it right now, and we'll definitely let you know when the eligibility expands, but we are starting to really think about expanding vaccine eligibility. So yes, I don't know what those eligibility criteria are going to be, but there are discussions around it. Is monkeypox internal or external? I think that is questions about like whether there can be internal lesions. A lot of people have external, meaning like, usually it shows up on the skin, but sometimes it can show up in the throat, which is still kind of external, but can be kind of more internal. There have been a few cases, not very many, like, probably less than 10, where people did sort of have some brain infections, lung infections, and then people can also get it sort of in the rectal area as well. So sort of internal in the internal rectal area. So those are sort of the most common internal type of things. Is the monkeypox contagious? Yes, it is, but it's not COVID contagious. You can't get it, really like breathing the same air. It really has to be like very, very direct contact.
I think
If we get, go ahead.
I was just I think about COVID-19 that we also really need to understand was this was like a perfect storm. This was a highly contagious thing that spread from person to person, where folks can be infected and contagious and not symptomatic. So it kind of like was a perfect storm. It's hard to detect it. It's hard to kind of really stop it spread in ways that thankfully in PXV is easier to stop, things like Ebola as well. So that's kind of why the COVID-19 definitely kind of threw us all for a loop. I don't think anyone was really, that the world was not prepared to address that thing, just because of some of the features of that virus. So yeah, it was definitely a standout in terms of outbreaks.
Okay, how do we minimize likelihood of contracting Legionnaires' disease? There, a bit of a random question, but I can try to answer. There's not really, we do track Legionnaires' disease, and it usually affects those who are older, but, I think it really is I think the places where we do see outbreaks are really where in water towers. And so there are regulations for like cleaning and disinfecting water towers. And so kind of making sure that like your super and, is on top of that. I think it usually happens sort of, I think in the summer months, because people are turning on their air conditioners, as well as sort of the way water is circulated during the summer and cooling towers. So that's really kind of where Legionnaires is sort of,
just being aware. The city does report if there's an outbreak, they make it public so folks can know what's going on, if there's like a cluster or a place in the neighborhood. But I think also, checking online, you can kind of see some of the regions where outbreaks tend to happen based on like the building design. That's another way just to kind of have an awareness that maybe it could your building or your neighborhood may have it's possible for an outbreak, or if it's had one.
Okay, so let me jump back to we have like 3 minutes. Let me see if we can do a couple of COVID vaccine questions. What is booster recommendation for people who are living with someone who tested positive but did not get it themselves? And the booster recommendation is still the same. If someone got the J&J initial and the booster, can they get bivalent? Yes, I would. So basically, even if you got one dose of J&J, if you got one dose of J&J, you're considered fully vaccinated. And then the next step would just be to get the bivalent booster, and then you would be considered up to date. So the bivalent booster basically sets everyone to 0, regardless of what you got. So fully vaccinated, no one has gotten a booster. And so now everybody's supposed to get the bivalent booster, is how I would think of it, regardless of what you got before. Will COVID-19 and monkeypox ever become non-existent? I think it's still too early to tell for monkeypox. We don't know, if it'll peter itself out or not. So still too early to tell. COVID, I think, is probably here to stay, just because it's a very tricky virus. It changes quite quickly. So I don't think so. But the hope is that it would eventually sort of be a little bit more like the flu, where we have flu, kind of in the winter once a year. And maybe there's a once a year shot that can prevent or really prevent people from being hospitalized and getting really sick from it. That would sort of be the most ideal situation.
What I will say is, I don't think that, getting to zero is really hard. We've seen other countries really go for like zero policies, which are really austere. Folks are being locked up. The entire populations are being tested in some spots. So that's really hard to kind of maintain as well. I don't think there's a lot of will for it in the United States. But I think the thing about it with COVID-19 and flu, there's a level of, folks get it, folks get sick and die. And I think folks have to be aware of that, like, what can you do to reduce the risk? Flu kills, what is it, like, over 20,000 people a year, a season on average? Like, that's a lot of folks from something that's been around for a while. So, thinking about that, again, it's like, what can we do to keep ourselves safe? Knowing that these things probably are going to be circulating around. We do have tools. For that last question, not about contracting MPV due hookah smoking devices. If you're out in public, I would be definitely using the disposable tips. I wouldn't be putting my mouth in any of that. And in terms of transmission through like pipes or whatever else, hard to say, hard to test. But I think for MPX,
really
I think the risk from hookah and smoking devices is lower. But if someone's infected, and I wouldn't use a hookah or smoking device with someone who's actively infected. I think concern about like communicable diseases, respiratory things, COVID and other things are probably
more likely to get COVID from hookah.
From a hookah or smoking device.
Yeah. I mean, I can't ever say that, no, it won't happen, but it just seems very unlikely, just given what we know. Same thing, I think there's a question about plastic gloves to avoid catching monkeypox. Again, we really are seeing most of the cases sort of through more sexual contact, direct skin rubbing for like a prolonged period of time. So I think holding up, I have not been wearing plastic gloves. I will I'll shake hands, I'll like hold onto the subway pole. I'll sit in the, the bus seats and all that. So yeah, I think there's also a question about like laundromat. I really don't think, monkeypox is pretty effectively killed by laundering. I don't really think that it's going to really be spread through laundromats. I think the concern is really more maybe people that work there. But in general, I really don't, you're managing your own laundry. So I don't think it's going to really be an issue even if somebody who has monkeypox brings in their laundry to the laundromat. You're not exposed to their clothes. So I think I don't think it's a big issue. Okay, I think we're 1 minute over. We got to as many as we could. I think we didn't do too bad, but yeah, if there's anything pressing that's left over, we can we'll file it and answer it, sort of prioritize it for the next city workers briefing.
We'll look at what scheduling the future sessions will look like. If it's every other week or maybe once a month, we'll see. But we wish everyone a safe, warm, and happy weekend. Happy fall, happy Libra season, happy weekend. Take care, everybody. Thank you.